Good day, I'm 4th class Decadent Ventic and I'm going to discuss about first aid. What is first aid? First aid is an initial assistance given to someone that is injured or has become unwell. Make sure you are not in danger before you attempt to perform first aid. These are the priorities of first aid: to preserve life, alleviate suffering, prevent the condition from worsening, and promote recovery. What is inside the first aid kit? First is guidance leaflets, plasters, gloves, triangle bandages, ice packs, scissors, different shapes of and sizes of bandages, ice bandages, and adhesive tape. Primary survey is important in first aid. Basically, looking for anything life-threatening and dealing with that with your casualty. So from primary survey, we're going to look at an acronym DRABC, which hopefully help us to remember a little bit easier. D stands for danger. Check for danger for yourself. R stands for response. Check for response of the casualties. Are they alert? Can they hear you? If you are on your own, you should always try to ask for help from people nearby. A stands for airway. Move on to check the airway. Use a hand to chin left. B stands for breathing. Check the breathing and do it for 10 seconds. Look at the chest rise and fall. Listen to feel breath on the cheek as well. If I'm breathing normally, then we will have to look for obvious signs and any injuries and deal with those and place them onto what we call the recovery position, which is to maintain an open airway. R stands for CPR. Anything other than normal breathing, start CPR. There's something called agonal gasp, a medical term used to describe struggling to breathe. It often occurs because the heart is no longer circulating oxygen-rich blood. Give the casualty 30 compressions at the rate of 2 per second. Next thing you do is the secondary survey. Secondary survey is used to determine the extent of the casualty's injury. It consists of looking at their history, signs, and symptoms. Something you can do for a conscious casualty, or it can be unconscious casualty as well, as your secondary survey consists of looking at your history, signs, and symptoms. So the history might be the history of the casualty, so perhaps any medical condition that they've had that could link a casualty at a moment. AED, Automated External Defibrillator. What is AED? A piece of kit that can increase the casualty's chance of survival by up to 75%. It analyzes the casualty's heart rhythm by determining whenever there is a shockable rhythm. It will then try to shock the heart to restore a normal heartbeat. External defibrillator. One is pocket mask, towel, razor, scissor, pads going to apply to the chest. Chain of survival. What is chain of survival? Chain of survival is the key to giving somebody the best chance of survival in living. So, the chain of survival consists of 4 links. First is recognition. Early recognition for the casualty's breathing and call for help. Second is CPR or cardiopulmonary resuscitation. Perform the CPR earlier. Next is AED or Automated External Defibrillator. Perform an AED earlier to the casualties. Next is resuscitation. Post early resuscitation care. Make sure they can get to the hospital and get that medication and specialized medical equipment as early as possible.